So my name is Gokul KandaSwamy. I'm one of the urologists here in Sancta Maria, and I also work in the Swansea Bay Health Board. My primary area of interest is bladder and prostate pathologies. My day job primarily involves around cancer management, and I do robotic surgery, again related to these two organs and pathologies around it. In Sancta Maria, here urology department offers a very wide range of services. We do deal with pretty much every aspect of urology, whether it is oncology related services, so like evaluating blood and urine, evaluating for prostate cancer, or doing studies or tests for kidney cancers and so on. We do a range of interventions again towards cancer diagnostics, like cystoscopies, prostate biopsies, and then ultrasound scans for testicular cancers as well. We also cover multiple other subspecialty work, so evaluating and treating women with urinary tract infections and so on. Yeah, you're right. Prostate cancer risk for someone who lives in this part of the world is 1 in 6. So 1 in 6 men in this country is likely to develop prostate cancer. Having said that, amount of men coming forward to have it checked is not in proportion to it. Now we have national studies. Year after year, we have something called National Prostate Cancer Audit. It says somewhere around 15-16% of men are diagnosed with metastatic cancer at diagnosis, which means these are men where first diagnosis is happening and the cancer has already spread to other parts of the body. Yes, we don't have a very robust national screening program. There's a lot of reasons behind it, but there is definitely a big opportunity for men to have it checked and diagnosed early, especially if they have risk factors. There are a lot of literature available. So if you fall into any of those criteria, you should come forward and get checked. There is a reluctance, in spite of me saying this repeatedly over and over again in different media, news, etc. And that's probably because every human being is different. Some people don't want to know. Some people actively seek to get diagnosed, treated early. We understand that, but this is a cancer where if it is diagnosed and treated very early, the complications are less. The quality of life can be pretty much maintained as it is, rather than go through quite difficult treatments later on. So I'm just purely taking this as an opportunity to reassure the diagnostic pathways are simplified, it's less painful, and it's swift, and we can get a good yes or no answer by just simply going through the process. There's other main reason which we have addressed nationally through our both section of oncology as well, is about the actual diagnostic process towards prostate cancer, which seem to inhibit or determined from seeking attention. Previously, the diagnosis was based on having a blood test and also having a prostate checked through a rectal examination, what we call as digital rectal examination. And this seemed to be something people are not keen to have it done and avoid the whole process just because of this particular aspect. We addressed this with a national document to say that yes, it's not mandatory anymore for a particular rectal examination to be done before referral to secondary care. If you have your PSA abnormal, you would be eligible for referral and evaluation with urologists with tests like MRI scan, which are much more sensitive and specific, and thereby we can avoid doing rectal examination. This is specifically for men who are reluctant to have it. Is it a good test to do? Yes, it's a good test to do, but this is particularly for men who are keen not to have it done purely because of this. What we know over the years being in this business is patients come with a lot of anxiety. For many a times, the environment they are walking in is for the first time. They don't know where they are going. They're just taking everything on board. And they're probably already in a lot of worry about what their diagnosis is, and potentially in some patients, if it's cancer, the worry about cancer, and the first thing that comes to mind is, am I going to die, and so on and so forth. We understand that, and many a times we also know, and even after like half an hour consultation, when we ask patients to repeat, okay, what have you understood? Could you just say what I just what I just told you, 90% of them can't reproduce it fully. And some of them who can reproduce, they do miss out a lot. And there are instances where people have generally just not taken anything at all. And again, this is particularly more pronounced when you hear cancer as your diagnosis. So we're fully aware of this. And there are again a lot of efforts and steps nationally and know how to overcome this. And we also customize it to individual patients. Sometimes we arrange second appointments. Sometimes we ask them to come back with a family member. Sometimes we give them enough handwritten information. Sometimes we advise them to write down questions, whatever that comes to their mind, and arrange another appointment to specifically go through what they've written down. Because many a times we think, oh, I'm just going to come and ask questions. I'm pretty sure you will miss 10 out of 20 that you wanted to ask. So we encourage people to write down. There are very standardized information leaflet on pretty much everything in urology. So we give you access to that. We print them out and give it to you, or we direct you to the websites. We show you the websites. We give you the QR code so that you can have them on your phone to access and read them. We give contact details of our specialist nurses whom you can contact anytime around the week. They will reply back, address your questions as early as possible. And if required, you'll come back to see the specialist nurse directly, or you come back to see the consultants. So it's not one solution for everyone. Some patients, even after first consultation, will move on to treatment. There are instances where we have to have 3 or 4 consultations. So as long as it takes for you to fully understand what it is all about, what your next steps are, and then proceed from there. Yeah, it's a very wide range of things. Now, urology is such a broad specialty, and in fact, the statistics say 1 in 2 in the general population will require a urology input at some point in their lifetime. And that could be anything and everything. What we commonly see in a private setup is sometimes geared towards what the local needs are. So sometimes how your NHS system works locally will also direct certain flow of certain patients into private sector. Having said that, pretty much most of the procedures done in NHS are done in private sector as well, especially in urology. Again, simply because it's a specialty where technology came in very early. There's a lot of advancements. Most of the procedures are minimally invasive. Urology is one specialty where a lot of procedures are day case based. You come, get it done, go home same day. Even some of the cancer procedures are like that. So yeah, pretty much anything in urology, we can start with the consultation privately, and most of the treatments can be delivered privately as well. I think one area where there has been very robust development is in the area of prostate diseases and treatments. The prostate cancer treatment surgically is robotic surgery these days, and that's quite well set as the standard of care. But for those men who do not have cancer but need a surgical option, the TURP, which has been the standard approach of shaving the prostate in small bits to make the channel bigger, has been the standard of care for many years. To some extent, theoretically, it is still the standard of care, but again was given as a solution as one size fits all. But this is one area where there has been lots and lots of development. In fact, every 2-3 years, there is some new technology or some new advancement. So in Sancta, for example, we do UroLift, which is a day case procedure with absolutely zero impact on sexual dysfunction or any sexual side effects. It's a day procedure. You get it done, go home same day, no catheter, and so on. We also do ITIND, which is a procedure where the prostate is not the big issue. It is the musculature which is the main issue. And to be honest, it happens in quite a big percentage of patients, and it is very poorly addressed with any other new developments. So ITIN specifically fits well into it, and Sancta is the only private hospital in South Wales which offers ITIN for those patients. There is also Resume, which is again for certain very specific indications. Again, the case selection is crucial for all these what we call as MIST procedures. They are the minimally invasive surgical techniques for benign prostatic enlargement. and Sancta is one of leading sites for that in this part of the world. Yeah, well, I've been working in Sancta for almost 7-8 years now, and we have moved to this new building just around the COVID times. And the first time we walked into this building, it's like a 5-star hotel for the first time when I walked in. Amazingly well maintained, clean, spacious environment. Absolutely lovable staff. It's just a great team here that works patients in the administrative office, in wards, in the theaters. We know each other by name, by first name to be specific. Very friendly unit. It's a very good team. Smoother the experience for the surgeon, for the patient, the overall outcome remains good. So it's starting from booking, coming into clinic, the transition from seeing a consultant from outpatient, going into theater, ward, and any follow-ups that's required after that, and even the post-surgical follow-ups, out of hours, reachability. It's just been a very well-oiled machine, and that repeatedly comes out in patient feedbacks. And of course, if there is anything that we can always learn and improvise, we listen, we learn, we improvise. We meet every 4 months in our MAC meeting. We look at all these, any minor issues or any major issues for that matter, and that's been regularly addressed so that the best is always been delivered to the patient. Oh yeah, this is a tricky question because I've never been on the other side. So how I would process the information is something I honestly don't know. I once had to give a cancer diagnosis to a very senior cancer specialist nurse, and I was blown away by the way she took it. That's always in my mind. So I don't know how I would take it. Yes, it's easy to be on the other side. What I would want to know, keeping my emotions aside, thinking about it now, is I want the surgeon to be honest about everything, starting from what needs to be done and what the impact of each and everything that would be done, side effects, risks, complications, alternate options, what happens if we don't do anything, and so on and so forth. I need to know the prognosis, which means what is the likely long-term outlook of my disease and at what options I would have at what different times. And any advice regarding what I can do for myself or the best outcome for myself in surgeon's own views. The surgery is not perfect all the time, in the sense there's a lot of factors that impact the outcomes. So I value the surgeon's experience, and anything out of his or her experience that they could tell me, I would absolutely value that. And any advice that they could give to my family, because at the end of the day, anything that happens to me, they are the ones they are going to be impacted the most. So yeah, that's probably what I would look for if I'm a patient. I'm Gokul KandaSwamy. I'm a urologist here, working here in Sancta. If you have any questions, please get in touch with us.